Our story begins in Zaire, now known as the Democratic Republic of Congo, in September of 1976. A report of a strange new illness comes into the capital. The symptoms of the illness: fever, muscle and joint pain, vomiting, diarrhea, headache, rash, and sore throat. This new disease had already spread to dozens of people. The people who had died were buried according to cultural customs, which included clothing and washing of the body, touching it and kissing it. Later, they would discover that these rituals were actually allowing the virus to spread through families. After international epidemiologists and doctors came to investigate, it became clear that this was an outbreak of a new infection. Under the microscope, the pathogen was identified as a member of the Filoviridae family because of its worm-like appearance. Although the virus looked very similar to the Marburg virus, it was slightly different and was then named after the nearby Ebola River. Fast forward 38 years to 2014, and we knew much more about Ebola. Although we now knew that Ebola was an extremely dangerous infectious disease which causes hemorrhagic fever and about 50% of people who contract it will die, there hadn't been that many serious outbreaks, with the biggest being just 425 cases, and Ebola had never spread outside Africa. However, in January of 2014, the most severe Ebola virus epidemic had begun, and by January 2016, almost 30,000 people had been infected, and the virus had spread to 10 countries. This scared many people, and there was an extreme amount of media coverage. But how exactly does the Ebola virus spread from person to person? The Ebola virus enters the body when a healthy person comes in contact with the bodily fluids of someone who is infected. These infected bodily fluids enter the body through passageway, like the nose, eyes, or mouth. Once the virus has entered the body, it begins by attacking the immune system cells and neutralizing them, allowing the virus to multiply. As the virus spreads, it attacks the lymph nodes and vital organs, causing them to lose function. When so many cells in the body are killed, an immune response called a cytokine storm is set off, which is an explosion of immune cells that can damage blood vessels, which causes bleeding internally and externally. This extreme fluid loss can be fatal in as little as a week. Following the end of the 2014 Ebola outbreak, the World Health Organization has identified the major steps that need to be taken to stop the spread of the virus and prevent future outbreaks. These include reducing the risk of wildlife to human transmission from contact with infected fruit bats, monkeys, apes, forest antelope, or porcupines, and the consumption of their raw meat. Reducing the risk of human-to-human transmission from direct or close contact with people with Ebola symptoms, particularly with their bodily fluids. Implementing outbreak containment measures by identifying potential cases and keeping them quarantined for 21 days, and by separating infected people from the healthy. Reducing the risk of possible sexual transmission. Reducing the risk of transmission from pregnancy-related fluids and tissue. And producing and dispensing of vaccines. As well as prevention, the effectiveness of cures and treatment have also been assessed. The most important and effective treatment of Ebola is hydration. This is most effectively done through intravenous access. It is also extremely important that electrolytes are kept up whilst a patient is infected. Treating specific symptoms has also shown to help maintain the overall health of the infected. As of April 2020, there are no proven treatments that neutralize the virus. However, some therapies are under trial. Because Ebola is spread through contact with the bodily fluids of someone with the virus, it is very unlikely for it to be contracted even if you are walking or standing near an infected person. The most common way people are infected is through direct contact with the severely ill. This poses the highest risk to medical workers and friends and family members of the infected. Furthermore, the primary locations where all Ebola outbreaks have started, such as Central and West Africa, have poor sanitation and infrastructure, and a lack of advanced medical centres. So Australians don't really need to be worried yet. However, it is good to be educated on such diseases, and understand just how deadly and infectious some viruses can be.